Okay, well, hello and welcome everyone. My name is Ray Marcotte, and I am the Reference and Technology Librarian at the Windham Public Library in Windham, Maine. And tonight's program is entitled Preventing Cognitive Decline with Dr. Rudy Mueller. Dr. Mueller was trained to address the body in a holistic manner with the understanding that physical and emotional trauma, along with thoughts, toxins, and food, can disrupt the person's physiology and create symptoms and lead to a diagnosis. He developed a passion for functional medicine and became a certified functional medicine practitioner through the Institute for Functional Medicine and earned an advanced fellowship in anti-aging and regenerative medicine. He has additional training in genomics, reversing cognitive decline utilizing the Bredesen protocol, autism spectrum disorders, Lyme disease, and enhancing athletic performance. So I'm going to give it over to Dr. Mueller. There's going to be time for questions at the end of his presentation. So welcome, Rudy.
All right. Thank you, Ray. I appreciate it. And thank you for taking the time this evening to jump in on this conversation about preventing cognitive decline. Now, I've created some slides here to kind of guide this conversation, but I very much want to be able to have a back and forth here with Ray, as well as you. And so if you have any questions as we're going through this conversation, this talk, feel free to put it in the chat and I'll answer questions along the way. And then we'll have some allotted time at the end to answer questions that you may have. So preventing cognitive decline, it's something that's pretty fascinating to me, especially from where I started to where we are now, about 12 years into being a physician. This is a picture of my family along with my mother-in-law recently this past summer when we were visiting a lobster shack up near, I think it was called Perry's, up near Bucksport, Maine. And we have our practice located in Scarborough, Maine, and that is called Precision Health Family Functional Medicine. And really, this journey started for me when I was about 9 years old. I witnessed my father have his first stroke until he had multiple strokes until he eventually passed away when I was going into my senior year of high school from a heart attack. And I watched this man take medication after medication, take supplements, go to an acupuncturist, go to different physicians, and he continued to digress and never really improved. And as a child, I remember thinking to myself, well, when I go to the doctor and I get a medication, I take it for a short period of time, and then I feel better and I stop taking the medication. But why is this not working for my father, or why didn't it work for my father? And it really started the wheels turning as I went into undergrad and studied the human physiology, and then eventually going on to grad school and being handed the textbook of functional medicine. And the textbook of functional medicine really opened my eyes to a different paradigm. We have emergency medicine, we have this traditional medical model in place, and it really started from we have an acute issue, we need a problem to solve that acute issue. For instance, a person's in a car accident, there's no place that I'd rather be than here in the US to help deal with the injuries that may result from that accident. But the fact is that when we look through the lens of this conventional medicine and we apply it to chronic disease and trying to really express overall health, it fails to get to the root cause. And that is what functional medicine is all about. It's about understanding biology, understanding physiology, biochemistry. Sorry, I just want to make sure everybody's on mute here.
I'm muted.
There we go. Biochemistry, the physiology of a human, and try to get to the underlying cause and driving factors. And with this ReCODE, which stands for Reversing Cognitive Decline, was something that I learned about after my education certification in functional medicine, that this Dr. Dale Bredesen, a neurologist and medical researcher, and published many articles, was applying this functional medicine concept. Find the root cause. Each person is an individual, and we must treat them as an individual approach, this personalized approach to the condition of Alzheimer's or cognitive decline. And I've had family members go through dementia and Alzheimer's, my grandparents. And so when I heard that this was possible, and the application of this functional medicine is being studied in this specifically, Alzheimer's disease, it really piqued my interest. So I really want you just to take a moment and think right now, do you believe Alzheimer's disease is preventable? And if you want to put it in the chat, I'd love that. We get some interaction here. And so do you believe at this time Alzheimer's disease is preventable, or is it something that is genetic and it's inherited? Just write yes or no. Is it preventable? And then, is Alzheimer's disease reversible? Yes or no? And if you don't want to put it in the chat, if that's too hard to figure out, just think about that. Do you believe right now that Alzheimer's disease is preventable and or reversible? Do you believe it's genetic? And so by the end of this talk, I hope you're able to answer those questions and feel confident in your answers, and maybe even switch the paradigm on you a little bit to change your mind in what we're seeing here. So one of the first books that I read on this was Dr. Dale Bredesen's book called The End of Alzheimer's, the first program to prevent and reverse cognitive decline. And since this book's release, we have seen further research in this area. And one of the interesting articles that came out was this one here in the Lancet. I'm just going to move some stuff around so I can see here. I hope everybody can you all see this slide okay?
Yes.
This little graph over here. Good. So what this did was, this was in the Lancet, and this had nothing to do with Dr. Bredesen and his work. This was just looking at dementia prevention and intervention in this 2020 report. And what it found here is, you can see along this gray bar, we have early life, midlife, and later life. We found that there's a percentage reduction in dementia prevalence when these areas of risk factors were addressed. So if a person is more educated versus less educated, they actually have a 7% less chance of developing Alzheimer's. If so, less education, you have a 7%, sorry, I misspoke, 7% increased chance of developing Alzheimer's. Hearing loss, 8% increased chance. Traumatic brain injury, 3% increased chance. Hypertension, alcohol consumption, obesity. And then later on in life, if you have a lifestyle of smoking, if you have depression or social isolation, and this is obviously a big area that came out of COVID, we were starting to see a lot of people become more isolated due to fear of getting the virus. And it took away our social connections, physical inactivity, air pollution, and diabetes. And if you add all of those up, it's 40% potentially modifiable factors that can increase your risk or even reduce your risk of developing dementia and Alzheimer's. And if we look at the total number of dementia cases, right? Dementia is this big umbrella term for cognitive decline. Alzheimer's fits underneath that umbrella, and there's many other conditions or diagnoses that fit underneath the dementia umbrella. We actually can see that we can affect 40% of people's future in whether they develop dementia or not by addressing these things. And when we look at these factors, we see things that are associated with nutrition, but we don't see nutrients or nutrition addressed in there. We don't see sleep addressed in there. We don't see, drive or mental and physical drive towards like an overall goal or purpose in life addressed in this area. And so when we take a bigger scope and bigger look at things, as we do through Dr. Bredesen's work in The End of Alzheimer's, we can even start to chip away at that percentage even more. And so with this approach that we're going to be talking about today, it is the reversing cognitive decline utilizing Dr. Bredesen's protocol. So I want you just to take a moment and think about and learn about the standard evaluation for Alzheimer's. Often when we're looking at this medical paradigm, the current medical paradigm in addressing Alzheimer's, it's a wait for the symptoms to appear, and then we go to the doctor. And often those patients go to the doctor very late when they have already short-term memory issues, when they have difficulty with calculations or difficulty finding words. It's very much a passive care. The patient is not asked to do anything except for take a medication and go see a psychologist or a neuropsychiatrist. The involvement of patient in this is seems as interference, or the involvement of the patient's loved ones around them is seen as interference because it's not going down that monotherapy medication route. And what eventually happens is people progress into a nursing home, and nursing homes, as we all know, can be very financially draining. Not to go too much into my backstory here, but recently my mom was in a motor vehicle accident causing severe trauma to her brain. And literally yesterday, I moved her from Pennsylvania to Florida and got her into a memory care unit. And to be very frank, the bill is $13,000 a month. $13,000 a month. Now, thank goodness she was a professor. She has a great pension. She has long-term care insurance, and she was financially stable to be able to do this. But I can't imagine if she wasn't, where that money would come from. What type of place would I end up having to put her in, where eventually we just see this further regression. And unfortunately, most people that develop Alzheimer's die in a very destitute state. When we look at testing, it's very simple. It's an MRI or your conventional panels that you get from your physician. Potentially, they do a neuropsych evaluation, and then a MOCA, which we'll talk more about here in a minute. And often the result of these, the neuropsych or the MRI and the MOCA, is here, take this donepezil, Aricept, Memantine, some sort of medication that is meant to slow the progression of Alzheimer's. Any questions or anything there, Ray? Anything else you want to?
Well, isn't it true that the literature says now that Alzheimer's actually it can be in place, like decades before it actually
Right.
appears?
Yeah, absolutely. You're stealing the thunder of some of my slides, but I love it.
Okay.
No, it's good. I'm glad. So yes, there's evidence to show that 20 years before the first symptoms start to arise, we can pick up on antibodies towards the brain or the plaquing that develops in the brain in Alzheimer's disease. And so it can take 20 years for the body to start to go through the process of breaking down over these 20 years before we ever get that first symptom.
Mm-hmm.
And so if we can catch this early on, we have much greater success than if we get somebody who's later on in the disease. And that's because of, if we can figure out all of the contributing and causal factors that are driving a person's physiology, driving a person's biochemistry to develop Alzheimer's 15, 10, 5 years from now, if we can catch those things and address them early, we don't have the breakdown that has occurred in those people that have already started to experience symptoms or are already labeled with cognitive decline or the diagnosis of Alzheimer's. And so the standard way that, and this is a test that we like to utilize as well in our practice to kind of track progress, is a MOCA assessment. MOCA is just abbreviation for the Montreal Cognitive Assessment. So when you look at this test, this is a great test for somebody who's already starting to experience signs, because most of us can look at this test and be like, wait, we can identify those animals. I can certainly trace, draw lines from number to letter to number to letter. I can probably draw that box. But if we have people who are having difficulty with this test can be great to help us identify who is going to be more successful with this treatment or this approach versus those that we're going to have more difficulty. Now, all that being said, you can see that the score is out a total of 30. I'll kind of tell everybody right now, if a person is at a 15 or a 16, that's kind of the comfortable cutoff. All of us physicians that practice this ReCODE feel comfortable that we can help a person make progress in their cognition. Below 15, we start to run into more difficulties in making progress. And now that's not to be said that we can't help people that are having these lower scores. In fact, we had a woman come into us who scored a 0 on her MOCA evaluation. And within 6 months, she was up to a 15. And we just were able to identify from the testing what areas we needed to address. We addressed those areas and she improved. And we can talk a little bit more about her if you guys have questions in the Q&A. So just Montreal Cognitive Assessment, the MoCA, is kind of a standard evaluation that's going to help you understand the next few slides here. So this is a study that was done recently when looking at the ReCODE protocol compared to no treatment and these new drugs that are on the market now called monoclonal antibody treatment. And what we see here on the left is the change in the cognitive score. So there are different cognitive tests. We have the MoCA test, we have the SLUMS test, and we have the, mini mental status exam, or the MMSE. They're all out of 30 points. And so this bar on the left is showing a change in points from baseline to 1 year after they performed that baseline test, how much change has occurred. And so as you can see, with no treatment, we're seeing a reduction in 3 points on average from the MoCA or one of these standardized tests over 1 year with no treatment. Then with the use of these monoclonal antibodies, we're seeing some slight reduction. We're seeing a reduction overall in the MoCA score that's slightly better than no treatment at all. And then with the ReCODE protocol, actually a year, we're seeing anywhere from 3 to 4 point improvement. Now, the drugs that are often recommended initially when a person is experiencing cognitive decline, I mentioned them earlier, but just to reiterate, Aricept, Memantine, Donepezil, Namenda, and a couple of others. They have been shown to slow the progression, as have these monoclonal antibodies. However, actually 5 years of taking these medications, it has been shown that when comparing 5 years of taking Aricept, Memantine, Donepezil, Namenda, compared to no treatment at all, people are actually worse after 5 years. And we don't understand the exact mechanisms there, but I'll tell you from my experience, once people are put on these medications, if we don't work to find a way to get them safely off those medications, it's harder for us to make a change in their cognitive faculties and abilities. And so that being said, the other difficulty here with the monoclonal antibodies is the side effects that come along with them. The monoclonal antibody treatment must be utilized very cautiously because it can cause brain bleeding and swelling as potential side effects. Yes, it can slow down the process of, or the progression of Alzheimer's, at least over a year. Not enough studies to show 5 to 10 years out. But it comes with its own risks, where, as you'll learn here with the ReCODE protocol, there's really no side effects. We're addressing the physiology, we're utilizing nutrients, we're utilizing lifestyle changes, sometimes utilizing advanced therapies or medications, but it's all geared to help address the biochemistry and physiology of you or the individual. Now, one note that I want to make, if you are taking any of these medications, this is not advice for you to stop taking those medications. Or if you have a family member who's taking those medications, it's not advice for them to stop. Things can get a lot worse when you just cut the medication completely. It must be done in an appropriate and responsible way with a prescribing physician. So the problem with the standard evaluation is that it often neglects these things. Now, I'm not trying to speak over you. You may not understand everything on these slides, but am I still there?
Yes.
Okay. I just want to introduce you to some of these concepts. I will send over these slides to Ray, and then we can get these slides sent out maybe with a recording so that you can have a copy of these and look through it. But we look at genetics. We want to understand what are your genetic predispositions, and they can guide us in making decisions. The big thing that we need to understand with functional medicine, and this is across the board, whether you're dealing with Alzheimer's, cognitive decline, or any other condition, it's the interaction of your environment, of your lifestyle, of your mindset, your social connections, and your microbiome that interact with your genes to either turn them on or turn them off. Now, we can get some nice insight when we look at our family history to maybe what kind of conditions or things we may be predisposed to. But when we actually look at the genes as a physician or as a researcher, we're able to pull out a little bit more information. Now, unfortunately, when you look at genetics, we don't have the idea of, is this turned on or turned off? But we can pair that genetics with your lifestyle, environment, the other things in this equation that I mentioned earlier, to look and try to figure out what is the right thing for you at this given moment. Because, Ray on this call, or I think I saw an Ellie on this call, just because they're experiencing the same symptoms, or maybe have been given and classified and placed in the same with the same diagnosis, does not mean that their underlying causes and contributing factors are the same. So these are the other things that we often see neglected. Inflammation markers, homocysteine, which is a marker of our body's vitamin status, fasting insulin, hormonal status, toxins, what's the immune system doing, our gut health, our microbiome, our blood-brain barrier, this think about like a mesh lining around our brain that protects it, not allowing certain things to cross over into our brain and not letting certain things out of our brain. That can be disrupted. MRI, we're looking at MRI volumetrics, so we can look at the size of your brain and the size of different areas within the brain, structures in the brain, within the brain, and compare that pre-ReCODE protocol and post, and we do see some improvements in the volume. So we see swelling in some areas and we see that reduce, or areas that have atrophied or shrunk, and then we can see that they gain size over time. And then very to little, no emphasis placed on lifestyle. Any additional questions there, Ray? Any other clarifications you'd like to make?
No. Yeah, I mean, prior to learning about functional medicine, I didn't know anything about fasting insulin or the microbiome, and those are pretty fancy words, but yeah, it's important that especially the brain barrier connection, the connection between the gut and the brain, those are things that functional medicine really focuses on.
It's looking at the body as a whole. One of my first mentors described the body as a Swiss watch. Now, you open up the back of a Swiss watch, and we have all of these gears and dials and things moving to all work together. And in conventional medicine, he's like, well, in conventional medicine, we only look at that one dial, the gastrointestinal system. We don't look at how that affects other dials and gears and maybe disrupt the time. We only focus in on the gastrointestinal system, right? We go to a gastroenterologist and he focuses on this dial. And we go to an endocrinologist and he focuses on this dial. And it's this combination and the interaction of how all of them play together to create who you are. And if you are a physician, if you're a gastroenterologist, I'm not downplaying the importance of these physicians. It is extremely important to have these specialists in these areas. It's just when we're applying all of these things, we don't have that doctor that applies all of the look over all of these different areas to a person. And that's really where functional medicine comes into play. And so once again, that book, and I think this is a great place, besides this lecture, to really start to learn a little bit more. Dr. Dale Bredesen dives deep into the science, so there's going to be areas that are up there in providing you with a lot of knowledge around the specifics that occur. And then there's going to be a lot of information that you're going to see here echoed in this presentation. But if you want to dive into more detail, I highly recommend this book. And this book was really, founded on these three papers here. He did a lot of studies on reversing cognitive decline over the years, and we can see that it got published. The downside to this type of therapy is that when you're looking at getting published in research, you're often hindered when you're looking at people as individuals, because it's not one therapy for one condition and then testing that against a double-blind placebo-controlled trial, right? This is looking at 100 patients and recognizing the fact that all 100 of those patients are slightly different, and then picking out the areas that are raising the flag the highest and addressing those areas for that individual, and then seeing an improvement overall in the end product of cognition. So this is a quote from the end of Alzheimer's: cognitive decline in early Alzheimer's disease and its forerunners, so the things that come before the diagnosis of Alzheimer's, mild cognitive impairment and subjective cognitive impairment, are reversible, and improvement is sustainable using a programmatic approach rather than a monotherapy. And this is what we're talking about, right? We're not utilizing a single supplement or drug or nutrient to address Alzheimer's. We're taking a whole person approach. And this is a recent study that looked at precision medicine approach to Alzheimer's disease utilizing the Bredesen protocol. And to kind of pull out some of the key information here. And I picked this up from a recent presentation that was on YouTube from one of my colleagues who runs a center in California. In this study, they looked at 25 participants. The stipulation here was that they had to have the MoCA score above 18. So it had to be a 19 or higher. And they integrated this 9-month intervention. 84%, or 21 out of the 25, showed improvement in their MoCA score, in their cognitive assessment test that we showed earlier with the pictures of the animals in the box and drawing the face of the clock. 84% improved. 12% declined and 4% had no change. And the fact is that this therapy, or this way of going, this protocol or this programmatic approach, is very difficult and complicated to implement, okay? And so we do need a good supportive system around us, especially for those that are scoring in this 19-20 range. But what's amazing here is that in this study, they evaluated for markers of inflammation, they evaluated markers of chronic infection, dysbiosis, which is an imbalance in microbes in our body or in our gut, insulin resistance, damaged proteins, looked at vascular disease, looked at how well a person was sleeping, or maybe if they had sleep apnea, how that maybe affected their cognition and their oxygenation of their blood and therefore their brain. They looked at hormone insufficiency or dysregulation. They looked at nutrient deficiency, toxin and toxicant exposures, and then other biochemical parameters associated with cognitive decline. And then patients were treated for 9 months with a personalized precision medicine approach for them. Then cognition was assessed at 3 months, 6 months, and 9 months after their baseline. And all of these outcome measures revealed improvement, statistically significant improvement in the MoCA scores, in another cognitive test, and in the Alzheimer's questionnaire. No serious side effects or adverse events were recorded during this, and in some, the MRI volume improved in their brain. And so conclusion of this study was based on the cognitive improvements observed, a larger randomized control trial of this precision medicine therapeutic approach should be warranted, and hopefully this will assist us in getting further funding to prove that this does work. So areas to assess and address for long-term brain health. So these are the areas where, when we're looking at a person, an individual, we really want to understand their nutrition. What are they eating every day? Are they eating processed foods? Are they eating organic foods? Are they eating plant-based, high-fat, high-protein? What is the diet or the nutrition that they're following? What are their nutrient levels like? Do we have micronutrient deficiencies? Are they potentially taking medications like a statin that deplete nutrients that are essential for good mitochondrial health, which mitochondria produce all of the energy in our body? And so one of the most well-known nutrient deficiencies that comes from a drug, so a drug-induced nutrient depletion, is a statin and CoQ10. So if you're on a statin, you should speak to your physician and you should get on CoQ10, 100 to 200 milligrams per day, to help improve that. Movement. Are people moving? Are they exercising? Are they stretching? Are they strength training? Are they working on their balance? Do they have social connections? What's their environment like? Do they live in a home that may have mold? Do they live in Maine and maybe have been recently bitten by a tick, or maybe bit by a tick a long time ago and had Lyme disease or another co-infection? How are they in dealing with stress? Are they implementing stress management techniques? What's their sleep like? And I'll be honest with you, this is the most overlooked um, area of lifestyle that I've seen in my clinic. We have people that don't fit the normal appearance of a person who would have sleep apnea. Now, sleep apnea is when a person snores or stops breathing at night. And what that does to the body is it raises stress hormones and it reduces oxygenation of the brain. Well, when's the brain recovering? It's recovering while you sleep. So if we're going through these sleep apnea sessions or having sleep apnea while we're sleeping, we're having disrupted sleep, not getting good recovery or deep sleep, and we're having reduced oxygenation to the brain, guess what can come from that? Hormonal disruption and cognitive impairment. So one of the first areas that we look at is sleep, and is a person apneic or not. Hormone levels, as we all age, it is normal, or I should say common, to see that our hormones dip. And what happens when our hormones dip? We lose the supportive hormone status that helps support neural connections, brain connections. And then finally, treatment of all of the different contributing factors, as we've mentioned before.
Rudy,
Yeah,
could I
yeah,
mention something about the sleep portion
yeah,
of
please.
your
Sure.
points? So what I've heard and read in functional medicine is that it's really, sleep is really important for your health. And also like stopping eating like 3 hours before bed so that you actually can get this deep sleep, so that your body isn't focusing on digestion. It's focusing on this sort of your brain goes through this sort of wash cycle at night as you
Right.
sleep. But if your belly is full when you go to bed, you're not going to get that.
That's very true. And so when we're talking about sleep, it's called a glymphatic system. So you think about, the heart is thought of as being the main driver and pump for the blood through our body. Now, a whole other talk, we could talk about how that's maybe inaccurate. But anyway, the heart is meant to pump right blood and move blood throughout the body. The lymphatic system is a tissue that requires movement in order to move the lymph. Lymph carries our immune system, it carries some toxins. And so it requires our muscles to contract and relax to pump and move the lymphatic system. In our brain, we have the glymphatic system. So it's the lymphatic system of the brain, which was really only discovered in the last 15 to 20 years. When we're sleeping and we could get good deep sleep, our brain actually contracts and relaxes, and it naturally pumps that lymphatic system. But if we fail to get into deep sleep, if we're stressed while we're sleeping, if we've eaten really close to bedtime, we lose some of that ability. And then that lymphatic system, toxins can build up. The immune system can have a hard time clearing things like plaques and tangles from the brain. So sleep is definitely a foundation, and I'll show that in the next slide here. But this is the Bredesen 7. These are the 7 areas of the lifestyle that we really focus in on. And when we do, see improvements in cognition. First off, nutrition. Next, exercise, sleep, stress, stimulation of the brain, detoxification, and then the utilization of different supplements that are keyed in and geared specifically to what we're trying to address at that time for the individual. We can talk a little bit more about nutrition, exercise, and everything else. I just want to make sure we get through the slides, and then maybe we can come back and hit on some of those important things. What slide is that? That's slide 19. This is another great image here. You can see the bed is the foundation, right? We think about the food pyramid, and the food pyramid that I was taught, and when I was in grade school, it had the grains at the bottom. We eat more grains, and then as you make it up, we have sweets at the top. Well, we've redefined that food pyramid for cognitive decline with this, and you can see each one of those triangles within the triangle are the same size. So utilizing fasting to improve blood sugar and improve a product called ketones in our body. Ketones are this alternative fuel source that our brain really likes, and it can help activate areas of our brain that may have had difficulty before. Nutrition, or the diet, exercise and movement, and metabolic health. But at the base of all of this is getting good sleep. Did you hear all of that, or was I breaking up?
No, perfect.
Okay, great. So one of the things that we really do initially for our patients or for our clients is we recommend this thing called a cognoscopy. Now, this is a brand new term that was put out there by Dr. Bredesen. And the reason we talk about he came up with the cognoscopy is like, well, we go get a colonoscopy, if we have risk or once we reach a certain age to screen for polyps or colon cancer. We do mammograms to screen for breast cancer. Well, what do we do for Alzheimer's disease? And so the cognoscopy is this initial evaluation, and it's all about the prevention and early reversal are the most highly effective approaches to cognitive decline. And so we want to capture this information as early as possible. And so we recommend that everyone 45 years of age or older undergo a cognoscopy. Or if you have a family history of Alzheimer's disease or dementia, at the very least 20 years before that typical age of that individual in your family. So we have some people that have family members that have early cognitive decline, happens in their 50s or even their early 60s. I have had a patient in their 40s start to lose it. So if that 45 years or that 20 years before the typical age of your family member who had it, whichever comes first, you should have this done. Now, I still would recommend that you have a good workup for your overall health as early as possible. One of the things that when I talk with men is, have you ever had your testosterone checked? No, I haven't had my testosterone checked. Well, when we look at labs, you have within normal limits, right? But it's often such a huge range that you don't know where you started. So for testosterone as an example, and this goes with many different other lab markers or biomarkers, the testosterone's normal values, depending on the lab, is 300 to 1100. I mean, that is a huge range. So if you fall in at 305 or if you fall in at 1095, you're within the normal limits. However, if you were a man or a person who had a high level of testosterone, let's say 1000 normally, and you drop down to 500, you just had a 50% reduction in your testosterone, but you're still within normal limits. So with functional medicine, with the ReCODE approach to reversing cognitive decline, we shrink those ranges down a little bit in some areas so that we can really try to fine tune and figure out how healthy or what are these contributing factors really present for you. And by tightening that window, we're able to pick up on some more abnormal values that may key us in on different recommendations that we may need to make. So as we mentioned earlier, the reason it's so important to capture this information early is that the pathophysiology, meaning that your physiology is changing to more pathology or bad things are happening. The pathophysiology of Alzheimer's disease begins approximately 20 years prior to the actual diagnosis. So we've had 15, 20 years of degradation or breakdown before we get our first signs or symptoms. And this has been based off of studies on spinal fluid and PET scans that have been done 20 years prior to the diagnosis of Alzheimer's. And they track these individuals over that time and then got the diagnosis of Alzheimer's. And they went back and looked, and they were able to find evidence that there were physiological changes that set them up to develop Alzheimer's disease 20 years later. Prevention and early reversal are the most highly effective ways to address cognitive decline. So the earlier we can catch it, the better. And so that's really why we recommend that 45 years old, we have a cognoscopy. And so with the cognoscopy, we're looking at these different things. We're looking at metabolic and toxin testing. We're looking at blood, we're looking at urine. Occasionally, depending on your symptoms or the individual, we may look at stool or saliva as well. We have an online cognitive assessment. If you're not, if a MOCA test, you're getting a perfect score, then there's another test that we can do to assess different areas of the brain. And obviously then we look at family history, medical history, medication, supplement lists, evaluation, past medical history, all of those things to try to figure out which direction do we need to go. Once we have those lab results, once we have that information, now we're able to identify contributors, whether that be metabolic, the immune system, microbiologic, like let's say Lyme's disease or herpes infection or Epstein-Barr virus. Are there different toxins that you've been exposed to? Glyphosate, right? The Roundup chemical that's sprayed on a lot of grains and are sprayed on a lot of lawns and golf courses, etc. Are you having vascular disease where we're losing good blood flow to the small vessels in the brain? Have you had history of trauma, whether that be physical trauma to the brain, concussions, or whether that be, trauma that you've experienced in the childhood, loss of loved ones, etc. And then what are the genes looking like? What's happening with the genes? What are they setting you up for, predisposing you to, and how can we be specific in addressing those factors for you? Then removing those contributing factors like insulin resistance, inflammation sources, toxins, and then looking at the neurotransmitters of the brain. And then creating resilience, optimizing nutrients, hormones, things that help build the brain, make those neuronal connections, and improve neurotransmitters. And then we finally rebuild lost synapses and other structural and functional losses, utilizing different chemicals, brain-derived neurotrophic factors, or brain training. So we identify contributors, remove those contributors, provide you good things to help with resilience and rebuilding. So a pretty simple concept. However, it's very detailed and very complex for each individual. So these are the lifestyle recommendations that we often hit on. Coming back to this picture here, talk about nutrition, exercise, sleep, and stress. And I've got some little notes here, which we can talk about if we have questions on them. And this is kind of the redefined food pyramid for the nutrition plan that we recommend through Dr. Bredesen's ReCODE protocol. And so this is called the Keto Flex 12-3. And as Ray indicated earlier, that 3 hours, right? So Keto Flex means that we're primarily doing a plant-based, moderate fat diet that's trying to get a person into a state of ketosis. As I mentioned earlier, ketones. Ketones are an alternative fuel for the brain, for neurological tissue. Primarily through the standard American diet and through our normal nutrition, we are sugar burners. So our brain utilizes glucose, but those areas can be tired if we have insulin resistance or glucose dysregulation. So it's like the glucose is trying to get into the brain cell, but the brain cell receptor is so tired from hearing glucose blasting as loud music for so long that that receptor becomes blocked or it blunts, and that glucose can't enter into the cell anymore. Well, guess what? There's a back door to that cell. And ketones, which are derived from fats or the burning of fat for fuel, can enter in that back door. And we can see in scans of the brain, people who are primarily on glucose, and these areas are not lighting up at all on the imaging. And then when we provide them ketones, all of a sudden those areas light up again. And so the idea here is to get into a state of ketosis, or this place of fat burning, provide good nutrients through vegetables and starchy, resistant starches, probiotics and prebiotics, getting good animal protein and fruit, getting some antioxidants, and then indulging in every now and again, some dark chocolate, maybe a little organic red wine. And then at that base, fasting. And so the numbers 12 and then the slash and 3 stand for how many hours of fasting per day we often recommend. And that's 12 hours of fasting. The 3 represents what Ray mentioned earlier, 3 hours before bed, we stop eating. So this actually becomes really doable. When people think of fasting, I know when I first heard of it, I was like, oh, I thought I have to eat 3 meals a day and snack twice. Well, you just need to get in a good calorie, good nutrient dense diet within your eating window. If you go to bed at 9 o'clock and you stop eating at 6, well, guess what? Fasting takes you till 6 in the morning. And then you break your fast with breakfast. And we eat inside this food pyramid's restrictions and stipulations, right? So 12 hours of fasting really isn't much. The key here is just trying it. Maybe even you're doing it right now, but potentially think about, what are the foods that I'm eating? Are they more sugar-based or carbohydrate-based? Are they processed foods? Or are they real food, things that would naturally grow or that we would find in nature? And if we can switch to one that's more nature-based, found in nature, natural, and less processed, our bodies are going to start to improve and respond beneficially. Any questions there? Any other things you'd like to add in?
Rudy, I'd like to point out that, yeah, so I've been doing that for about a year, not eating 3 hours before bed and doing at least a 12-hour fast every day. It's very easy. I mean,
Yeah,
it doesn't become difficult until it's maybe 14 hours or 16 hours, which
right.
is, that's not so much, it's not good for me because I'm already thin. I don't need to lose weight. But I just wanted to, put that out there to people that, a 12-hour fast is very simple, and it's probably the easiest thing you can do to reset your body, your metabolism. And if you look at this pyramid, the pyramid that we're somewhat used to is having, all those carbs and processed breads and such at the bottom. So, and like they say, about 2/3 of the American diet is that.
Right.
I mean, 2/3 of the American diet is processed food. We don't eat whole foods.
Yeah, I
Um,
mean, if you think about most of the processed foods, it's wheat, it's corn, it's soy,
yeah.
some dairy and egg. And those
Mhm.
are the things that we often find people have immune sensitivities to. And also, those grains are often genetically modified, and therefore they're sprayed with these high levels of pesticides in order to create and yield more volume
Mhm.
per square yard or acre of farmland.
And
So
and processed food, like breads and such, they have so much sugar in them. The average person
right,
doesn't realize that as soon as you eat a slice of bread, it turns immediately to sugar.
right,
So
and
your
that
blood
drives up
sugar is just spiked, and
right,
you
that
know.
drives up glucose, and then it prevents our body from burning fat and utilizing that alternative fuel of ketones.
Rudy, someone has a question in the chat. Do you want to
Yeah,
address it now,
yeah.
or
If it's meant, I'm wondering what the
she said, yeah, you see it?
effect does taking melatonin at night have on keto flexes. Is a way to address insomnia, or are there alternatives besides cognitive therapy? No, I mean, melatonin is a wonderful natural antioxidant that our body produces, and often we recommend higher doses of melatonin depending on what your cognoscopy or what your lab results look like. Melatonin can be a nice tool to utilize, especially if we're having insomnia. Now, what I would encourage you to do is start to address your sleep environment and then what you're doing during the day. So one of the keys here, and not to go too deep down a rabbit hole, but I want to try to answer this question completely. One of the biggest influences on our circadian rhythm, which is how our body's hormones and different things are released throughout the day, the biggest influences we have are food and light and movement. And so we want to make sure that we're approaching these different areas where we can pull and move around food, light, and movement so that our circadian rhythm can get back to a place where melatonin is being naturally produced and produced well. So often, I mean, maybe you've heard of this or not. We are exposed to all of these artificial lights throughout the day, whether that be recessed lighting or, um, the tube lighting, or even our computer screens and phone screens. They put off more of this blue light frequency. Blue light is present in nature during the day. However, as the sun starts to set, the blue light in our homes, on our devices, are still signaling to our body it's daytime because we're getting a lot of blue light exposure coming in through the eyes. And so the blue light actually stops our pineal gland, little gland in the brain, to producing melatonin. And so these are not a pair of them. I don't know where my blue blockers are, but they sell these different colored lenses. They're like yellow or orange that can actually block that blue light. So a strategy to improve natural melatonin production would be to wear these types of glasses when you're exposed to artificial light after the sun sets. Some phones and computers, you can download programs where at night it will actually turn down the blue light on the backlight of the devices. I think one is called F.lux, Flux, F.lux. It's a program you can download onto your computer that naturally dims the white or the blue light, excuse me, that it comes off of the screen. Another thing is exposing your eyes to natural light throughout the day. In the morning, when you expose your eyes to natural sunlight, so remove your glasses, prescription glasses, sunglasses, contacts, go outside in the morning, go for a little walk around the block, expose your eyes, and don't stare at the horizon or don't stare at the sun, but allow your eyes to be bathed in natural light. It actually helps reset that circadian clock. We also mentioned exercise and food being stimulus that can throw off circadian rhythm. That is one of the reasons we do the 3 hours of before going to sleep, you stop eating. Now, some people, we have to play with this a little bit. If they have blood sugar dysregulation early on, we may change that. And then with movement, we want to be exercising every day. So often for people that are dealing with sleep problems, besides addressing their direct sleep environment, making sure it's dark, making sure there's a white noise, if that's something that's comfortable, that the room is cool, other factors that go into that, we have them go out in the morning and go for a walk while their eyes are exposed to natural light, and we have them do that again after dinner time. Same thing, exposing your eyes to the natural sunset or the light, and allowing that to bathe and start to signal your eyes that it's time for melatonin to be produced.
Thanks, Rudy. There's another question
Yeah.
on Zoom. I'm not sure if you want to go there now or.
I'm curious, for women with the changes in hormones, we are more likely to experience Alzheimer's. How does fasting, which I've been doing 16 hours most days for a while, help? And how does HRT come into play with all that's going on? So certainly. So getting into these longer fasts can be really beneficial. We do see that the drop in estrogen and progesterone and testosterone that occurs for women is a contributing factor to decrease in cognition. And so with each individual, we want to assess what those hormones are doing and then come up with a plan. Some people we recommend hormone replacement therapy, others we don't. It really depends on the individual. But I can tell you that some of the fastest changes we've been able to make in a person's MoCA score and their overall cognitive ability come when we see hormones are depleted and we add them back in. It is like a light switch getting turned on. Many within 3 months, up to 6 months, but many very quickly, all of a sudden start to have that. They're back to word finding. They're better at calculation. They're better at short-term memory, remembering faces and names, and it can click on really quick for individuals. And that goes for all trophic substances, nutrients, and things that a person may be depleted in. But it has to be done responsibly, right? So just as a caveat, you want bioidentical hormones. You do not want to take estrogen orally. That increases risk for cancer. We do not want to take progestins. We want progesterone. And we want these things topically. Progesterone we can take orally safely. And then testosterone is a big one for females. I mean, I know we think of testosterone as the male hormone, predominantly male hormone, but testosterone is extremely important for maintaining muscle, strength, balance, and cognition for women as well. And we see that drop in testosterone with women occur. And it can be very nice and beneficial to them and their significant other if they get a little testosterone as well, because obviously it improves sex drive as well. So cool. Now, I don't want to go into too many details here, but how do we actually reverse cognitive decline? Well, first thing that we do, we assess all of those things through the cognoscopy that I mentioned earlier. We dive deep into the lifestyle factors, and then we start to play with nutrients, herbs, possibly medications to address all of these things here. Improving detoxification, chemicals, metals, mercury fillings, lead that's being leached from bone due to osteoporosis, mold toxins that are present in our home, Lyme disease. All of these things play a factor into a person's loss of cognition and then eventually their improvement. We have to go in and address those things. And we do it many different ways, but we have to always remember to be personalized and specific to you or to the individual. And so coming back to this, I want to know in the chat, after this talk, do you believe that Alzheimer's disease is preventable? And do you believe it is reversible? And I'll give a couple of minutes. I don't see anything coming in, so I must not have done a very good job. There we go. Yes. Thanks, Ray. And so, yes, they are. Now, once again, we want to capture it as early in the process as possible to have the highest level of success. And so what we have learned over the last 10 years of implementing this is that Alzheimer's disease is the result of a protective response to these 4 factors. So Alzheimer's disease is not a process where the body screwed up and made a mistake. It's actually a response that should happen. The problem is that we have these sustained environmental influences and over a long period of time result in this degradation or destruction of the neurons and therefore result in symptoms that can classify you as having Alzheimer's or cognitive decline. And so inflammation, if ongoing, right? If you sprained your ankle and kept spraining your ankle, we're going to have continued inflammation. So it's ongoing insult. Well, if we have inflammation that's coming because we have disrupted microbes in our mouth, or we have a tick-borne infection, or we have nutrient deficiencies that are causing inflammation, like, I see this question in here, Ellie, like omega-3 deficiencies can cause inflammation to rise, or vitamin D deficiencies can cause inflammation to rise. If it's ongoing, that destruction continues to occur. Insulin resistance, if we're blunting those receptors because we're signaling so much glucose, guess what happens? We have an inability to get nutrients into the brain for the brain to turn on and work. Trophic withdrawal, loss of nutrients, loss of hormones over time can result in cognitive decline. And then specific toxins can have an impact. And I will tell you, biotoxins, so toxins that come from living organisms, like Lyme, coming from tick-borne infection, or mold, another living organism, mycotoxins, are very specific toxins that can cause cognitive decline in somebody who's 20, somebody who's 30, 40, 50, 60, and all the way up. And so identifying whether those toxins are present is key and one of the often overlooked factors to a person's overall health, whether it's autoimmune disease, inflammation, or cognitive decline. A couple other things we've learned, that there are 6 subtypes of Alzheimer's disease that we can discover through the cognoscopy. And we do that through metabolic profiling. So think about it like a GPS, right? We're locating where you are currently. And then we have a destination that we want to get to, and we got to figure out what's the best, fastest, most efficient way to get you to that destination. And those 6 subtypes are what we're able to pull out from the lab results. So this is Dr. Bredeson's work, and I didn't go into all the different subtypes because I didn't want to confuse you. But when we look at the lab work, we're looking at which one of these subtypes or multiple subtypes is raising its hand the highest. And we start by addressing some of those through lifestyle change, supplements, medications, etc. Cognitive decline in early Alzheimer's disease is reversible, and improvement is sustainable utilizing a programmatic approach versus a monotherapy, versus a single therapy. And then finally, it does take a community. And I'll tell you, it does take financial resources for the testing, for the different supplements, for the time that's being implemented into this, and the amount of effort that it takes, especially for those that are already experiencing cognitive decline. It takes a good care team and support team around them to really make this change last for a long period of time. And then finally, for attending this talk, Precision Health, if you have any additional questions, if you want to talk about your case and maybe see if a cognoscopy is right for you, or if functional medicine may be right for you, you can schedule a discovery call with me. It's a free 15 to 20-minute call. If you have interest in this, we're going to take the first, I only see a few people, 10 people was what I was thinking, but we'll take all of you that are on this call right now. The first 10 people will do a free discovery call. You can click this link, or I'll put the link in the chat. Hopefully it's still here. Or you can email, and just in the subject line, put discovery call. And you can email us over at precisionhealthmaine@gmail.com. So we will open it up to questions here. Ellie, I can certainly talk a lot about omega-3s. It is something that we utilize for some people. When we look at a balance of omega-3s to omega-6 fats. Now, omega-3s are thought of as the really good healthy fat. Omega-6 tends to be the more damaged fat. Now, there are a couple of healthy omega-6 fats, but when we look at processed foods, they tend to be really high in omega-6 fats. And we think about inflammation pathways. Omega-6 increases inflammation if we have a high ratio of omega-6 to omega-3. And so more omega-6 fats in the system can predispose us to experiencing inflammation. Omega-3 fats, a healthier fat, can actually turn on anti-inflammatory molecules in the immune system to help reduce inflammation. And omega-3 fats, our neurological tissue, our brain, our nerves are primarily made up of fat. And so by putting in omega-3s, we can start to kick off some bad fats from the cell membrane and start to improve communication between those cells.
And I can add to omega-3s. What I've learned through functional medicine is that in terms of fish, it's really good to eat what's called the SMASH fish, SMASH, sardines, mackerel, anchovies, salmon, and herring. Yeah. Those are really high in omega-3s, and they're also they have less mercury because they're smaller fish.
Right.
So I think tuna is like through the roof with mercury, possibly. So
tuna,
avoid
shark,
that.
and swordfish.
Yeah, so avoid those. So a good way to remember is SMASH. Yeah, and taking a omega-3 supplement, I think, is a good idea.
Absolutely.
So, is there any questions in the chat? No.
Questions. If you would like to ask a question too, you can unmute yourself or raise your hand.
Oh, Karima's got a question.
Is functional medicine based on Ayurveda? Are there any studies? That's a great question. I don't have a lot of experience in Ayurvedic medicine. I have friends or colleagues that practice it. So I would feel like I'm talking out of my realm here by speaking about Ayurvedic practices, but I am very impressed with the success that these practitioners have in treating and working with individuals and improving their overall health. So this functional medicine and Ayurvedic can pair up nicely together, but I wouldn't say that functional medicine is based off of Ayurvedic medicine.
Rudy, can you just describe, what's the difference between functional medicine and conventional medicine in a nutshell?
Well, the example that I utilize in a lot of talks is I think about conventional medicine are the firefighters. When we have a fire, the firefighters come, they put out the fire, but they're not coming to rebuild the house. They're not coming to run the electrical or check the plumbing or figure out why necessarily the fire started in the first place. And then addressing why the fire started. And that's really where functional medicine comes into play. It's how do we find and address the things that may cause the fire beforehand? Or if a fire occurred, how do we rebuild the house so that it doesn't happen again and that it performs better than it did prior to the fire?
Yeah.
Is that a good analogy? Does that
Yeah,
make
yeah.
sense?
And
Yeah, okay.
and according to Dale Bredesen, a lot of the things that cause cognitive decline are preventable. It's, lifestyle largely.
Right. I would
Um,
say even better than preventable is that it's modifiable factors,
mhm.
things that are under our control. And so a lot of people get worried, and I've had patients who don't want to get their genes tested. Like the most common gene or the most well-known gene that's associated with the development of Alzheimer's is ApoE4. And you can have two copies. So you could be a 3-4 or a 4-4. If you have more copies of ApoE4, you have an increased predisposition developing Alzheimer's. People don't want to know that because it strikes fear into them. They think that this is it's like looking into the crystal ball. Well, I guess I'm developing Alzheimer's here in the future. And the fact is that the modifiable factors, the things that we can pick out through labs and talk and figure out through addressing and assessing lifestyle, can turn on or turn off those genes. And so just because you have an ApoE4 SNP does not mean Alzheimer's disease. Maybe it increases the chance, but now if we get to those modifiable factors early, we can shut down that ApoE4 from turning off.
Does anyone else have questions on chat?
Well, I hope those that were on here got something out of this talk, some good information and some general information around Alzheimer's disease, the studies that are being done to show that there is a method to helping reverse or even prevent cognitive decline in the future. And the fact is when we apply this systematic approach to a lot of different conditions, we can get improvement. And with Dr. Bredesen's work, it's been focused on reversing cognitive decline. And what I love is that his mission and our mission as practitioners is to make Alzheimer's disease like polio. We want to rid Alzheimer's disease from that ICD-10 coding. And I mean, it's a lofty goal for sure, but if we can start to chip away and we can start to prove and show more evidence about this approach and how it can impact an individual's life in the prevention of Alzheimer's and the improvement of cognition, we're having success and we're on our way. So thank you all for taking the time. Ray, I appreciate you putting this together. We've had a lot of back and forth. I appreciate everything that you've done to help get this information out there. And thank you everyone for your time this evening.
You're welcome. Thanks everyone for coming. Have a good evening.